Gary, I'm really excited about our conversation today, our topic today, managing your practice in less time with better results. And the reason I'm really excited about this is you have been on this journey literally for 44 years, right? Finding those nuggets, those wisdoms from the best of the best, the practices who are built to last, who are having a better year every year than the prior year, the practices where the dentist owner, the team members, even the patients love showing up to, and it becomes the family. And like I know some of these practices where team members are there for 15 years, 20 years, 25 years, and you have had the privileges of working with them. And here is a nugget I think didn't just come from, you know, AI or ChatGPT's tip, but rather came from experience and wisdom. So really, really looking forward to this topic, Gary. I know you have kind of shared with me what it is, but I don't want to ruin the surprise.
Well, I'm going to start by sharing a quick little story of my history. Many of you will know that I started in this profession in 1980, and I spent all of the 1980s working for two different large consulting firms, dental consulting firms. That's essentially where I learned my craft, or at least the foundation of my craft, as a consultant, as a coach. By 1989, I had worked with over 500 dental practices as a coach in all 50 states. My goal was to get to the point where I knew enough to start my own consulting firm. Well, in 1989, I still had a lot to learn. However, I had worked with over 500 practices. My wife was a kindergarten teacher. We had two kids at the time, later to become four. And we thought maybe now would be a good time to launch this consulting firm. So we took a big leap. It was a leap in faith. We figured out how to live on a kindergarten teacher's salary, which I don't know how we did that. My wife says I have selective amnesia. And you know what? She's right. But she's very resourceful, and we made it. And here it is now. What is that now? 35 years later. Darren, I've had my own consulting firm ever since. But my very first client, I wrote back then, we didn't have podcasts, we didn't have YouTube channels, we didn't have all the media opportunities that we have now. There were magazines and journals, and I was invited to write a monthly column for Dental Economics. Some of you might remember Dental Economics, some of you may still get it. But Dental Economics was a trade journal. And I was invited by their editor to write a monthly column. And he would also ask me to write 3 or 4 feature articles a year, where it'd be some topic. And he'd ask me to cover that in depth. And I was very happy to do that. And at the end of the article would have my byline, a little bit about myself. And back then, imagine that, Aaron, it provided my phone number. My phone number was in the byline. If you'd like to learn more about Gary, here's his number. And sure enough, a young dentist from Santa Barbara reached out to me and became my first client. And he was a new practice owner, a new practice owner. He'd owned the practice for about 6 months. And I remember vividly what he told me. He said, Gary, the dentistry stuff isn't going to be a problem. I'm always going to be working on my continuing education and advancing my skill set. And I'm always going to be, working on learning the latest, greatest advances in clinical dentistry. But man, this practice management stuff, managing the practice, I really don't know anything about that. I'd like your help. And he became my first client. And here it is now, Naren, that was 1989. Here it is now. Think about that. 35 years later, he's been a client of mine ever since. So this idea of managing your practice and learning how to do it effectively is kind of an age-old challenge. It goes back. We have some listeners that we know because we've received emails from you that are second and third generation dentists. So if it's a second generation, it means either your mother or your father was a dentist. If you're a third generation dentist, it means that your grandfather or grandmother was a dentist. And I'll bet if we go back to the third generation, they were dealing with management issues back then. So it's kind of age old. And when doctors talk about, like, let's say you're a practice owner, and they talk about the number of days they work. Like, how many days a week do you work, doc? And let's say the doctor works 4 clinical days a week. They usually say, well, I work 4 days a week. But that isn't usually an accurate answer, is it, Naren?
It's not.
Because what else do they have to do? as the owner of the practice?
I mean, they're working on the weekends, they're working on in the evenings. I mean, they're paying bills, they're,
They're managing their practice.
Yes, yes.
They're managing the business of their practice. So it's kind of been an age-old problem, but I'm going to share with you some things we've learned along the way in terms of coaching. The title of this episode is Managing Your Practice in Less Time with Better Results. And what I want to talk a little bit about is the magic of a check-in meeting, an individual check-in meeting with your team members. When we talk about meetings in the practice, I know that it causes doctors a lot of consternation to try to figure out how much time should we spend in meetings, because when we're in meetings, it takes away from the time that we have to actually spend taking care of our patients. So would you agree that that's kind of a problem there?
Yes.
Less time taking care of patients is, we're trying to have more time to take care of patients, but yet the practice has got to be managed, and it has to, they don't manage itself, as which I wish there was, a self-managed protocol, but it requires some leadership and some management to have it be done effectively. And we teach a model for our clients of 3 types of meetings to have in a thriving practice. One is a morning huddle, and that meeting is every morning. As a morning huddle title would indicate, it's a 7-minute meeting, and it simply sets the stage for making every day be as smooth and productive as possible. The second type of meeting would be most people would call it a regular staff meeting. I think the words that we use are important, so I like to call it a team meeting. I think team is different than staff. I like to say staff is either an infection or a stick that shepherds use. It's one or the other. So regular team meeting, and the way we do that at Life Smiles is we do every other Wednesday a 2-hour meeting, midday, 1 to 3, 1 p.m. to 3 p.m. It's 2 hours in length every other week. Most offices do a 1-hour team meeting every week for running, the day-to-day management of the practice. We like the idea of having a longer session every other week. We found that when we did the hour meeting, the morning patients would run over and they'd cut into our meeting. The afternoon patients would come early and they'd cut into the meeting. We didn't have enough time. But by doing a 2-hour meeting, it's the same amount of time that you're dedicating, but the 2-hour meeting allows you to do some in-service training, allows you to talk about some of the larger projects that we're working on, and gives you time to do some of the more complicated tasks that you're doing in the practice. And then the third form of the meeting that we use is semi-annual. We do it twice a year. It's an all-day meeting. Well, I should clarify that. It's all day, but the morning is a meeting, 8 to noon, where we talk about, we usually do these in January at the beginning of the year, and then also in the middle of the year, June or July. In the January meeting, we plan out all the major goals and initiatives for the practice during the year. Maybe we've had some new technology, we're bringing in new technology, and we do some training on that new technology. But that's a 4-hour meeting, 8 to noon. And then we have a lunch that's brought in, a catered lunch that's brought in. And then the afternoon, I recommend that you go out and you do an activity together as a team. The way I teach my clients to do that is that you choose 3 people on your team to be the committee. You give them a budget and let them plan a fun activity that you could do together as a team. Now, everybody's there. Everybody's on payroll. They're getting paid for this, but that afternoon session allows you to really connect with your team members in a way that wouldn't be possible without doing something like that together. You come up with a budget. Some things that we've seen clients do. We've done miniature golf. We've done top golf. We've done bowling, horseback riding, mountain bike riding, a trip to the lake and do wakeboarding or skiing, water skiing. We've done hikes together. One of our clients found a great local restaurant, a really well-regarded local restaurant that's only open for dinner. But in the afternoon, they do private cooking classes. And this restaurant did a private cooking class for the doctor and team. Escape rooms. Naren, are you familiar with escape rooms? Do they have those in Canada?
Yes, they do.
Escape
it's not
room
my
is a good
favorite, but my
activity.
kids love it.
Yeah, it's it kind of adds a exciting challenge trying to figure out how to
Yeah,
get it.
like it's too complicated for me, the challenge. So
Yeah,
I'm like useless.
but I've heard good things about those. But
Yeah,
you guys
I know,
are
like young people love it. I mean, like I guess I'm dating myself, but
yeah, yeah.